we would want to know from you. One being, what is your vision looking ahead for the medical devices, India's medical device industry, in the next, I won't say 5 to 10 years, because we are in the age of AI where everything is, expedited. So in the next 3 to 5 years for the industry, and also your vision for MTaI's role in shaping Indian medical devices, technology, policy, industry growth, and global standing in the MedTech supply chain sector.
So for the industry, my vision is it should be a dual track. Make in India also, and import from friend-shoring countries. What you cannot make at the most economical level or at the highest quality level. So make in India, buy economically for the patient quality products, design in India for the world, export to the whole world, not only your product but also your medical tourism. That means heal in India. So it's design in India, make in India, heal in India, train in India. Our companies train 250,000 healthcare workers every year. That means the whole of the market has been created by us. Because in pharmaceuticals, you can, once you know how to pop a pill or give an injection, all products will come through those routes only. But for medical devices, training is required for every device. So the device starts getting used only after training. So all these 4 activities, design, make, train and heal, in India should happen, not only for India but for the world. And from MTaI, we want access of quality products and quality technologies to the common Indian man, and we want to play a role in making that happen, and at the same time making finding a space which is commensurate to our contribution for the medical technologies companies which we represent. This is our broad aim.